Good evening. Today is Wednesday, April 15th. Welcome to the weekly live Facebook question and answer forum hosted by the Stanislaus County Office of Emergency Services. I'm Linda Muma with Stan OES.
And I'm Amy Vickery, Public Information Officer with Stanislaus County. We will be moderating tonight's live event, which will be recorded and later posted to the Stan Emergency Facebook page and YouTube channel.
You won't see us on camera tonight, but you will hear our voices as we help monitor the live feed and also direct your questions to our panelists.
Joining us tonight is Dr. Julie Vachampayan, who we will refer to as Dr. V, Stanislaus County Sheriff Jeff Dirksey, and Behavioral Health and Recovery Services Director Ruben Imperial.
Let's start things off with Dr. V, who will provide us with an update on the latest number of cases of COVID-19 in our community. Dr. V, what is the status of COVID-19 right now in our county?
So today we're reporting 177 cases. We still have 4 deaths. 77 people have recovered, and we have about 2,700, little over, negative tests.
And is this on target with what you expected to see?
Well, we've had a pretty good increase in cases over the last few days, going up 14 today, going up quite a few yesterday. So I had hoped we wouldn't be seeing this, but we are seeing this, and I think it just shows that there's still COVID-19 spreading in our community, and we still need to do everything we can to keep social distance and stay at home.
Thank you, Dr. V. So our number one concern from the Facebook community is related to testing. Are there any updates you can share with the community regarding testing?
Well, so we've talked each week about some of the barriers we're facing with testing, and one of the big ones is the swabs, and I talked quite a bit about that last week, and we're still having some difficulty obtaining the swabs to even start the testing process. We are trying to increase testing in our county, and we're pursuing some options and working with some vendors and looking at some drive-through testing.
Thank you, Dr. V. Our next question is for Sheriff Dirksey. Last week, the Judicial Council of California recently reset bail to 0 for most all nonviolent crimes in the state. On Monday, here in Stanislaus County, more than 60 inmates were released. It's only been a couple of days, and so this person is asking, have we seen any sort of impact on crime since that release?
It's too early to tell on that. The simplest answer is it's only been 2 days, and statistically we can't answer that yet. But kind of by way of update on that particular topic, first, let me say that I have a whole separate video that we put out specifically addressing the JCC and their change that they made and why they made that. If you want more details specifically to that, I would tell you watch that video. So on Monday, we released 54 inmates as a result of this new 0 bail change. Of those 54 inmates, 28 of them were already on probation for prior convictions. So many of them, it was not their first time that they were in jail. Since then, we have released an additional 45 inmates. And the reason that this goes on is that we had a large list the first time that we had to evaluate, determine those that met the criteria, and they were released. Then we have to kind of go back through the weeds, if you will, and sort out specific cases. Many of these people have multiple cases. Roughly half of them have multiple cases, and so we have to look at each and every case and each and every charge. With that, too, our DA's office has been working very hard to file essentially what are called bail enhancement motions. So if someone potentially qualifies for 0 bail, the DA can go and make an argument before the court regarding why they should not qualify given their proclivity to commit crime or whatever the case may be. And so that process, and then of course the public defender can make a counter argument to that, and then that goes before a court hearing. So that process is going on. That's one of the reasons we've also released a few more in the last few days. And then moving forward, I would expect that today, well, still this evening, tomorrow, we'll get even more of those minute orders, the orders from the court specifying what someone's bail will be, what it will be changed to. So there will be more releases. With that, we are tracking all of those who are released, and we are tracking our crime trends. Now, we're not tracking the individuals in the community. They are not wearing a GPS monitor or anything like that. There is no way for us. There was no mechanism for that under this 0 bail order, so we really can't do that. But we are, through our computer systems, we are tracking if they reoffend. We are tracking, like we always do, our crime stats, and if they're going up, property crime has been going up, that's for sure. Not dramatically, but there has been a steady increase over the last 2 to 3 weeks. And with that, the vast majority of those who are released from custody, many of them are regarding theft-related issues. The number one charge, grand theft auto. So I would encourage everyone out there, make sure that you secure your vehicles because there are more car thieves on the streets.
I wanted to stick with you for just a moment because this question also correlates with what you just said. This question came in over our Facebook feed over the last couple of days. We understand that you've also modified patrol staffing to keep the community safe. So what does that look like?
Yeah. So obviously this is very concerning not only to me as the sheriff, but all of our police chiefs across the county, all 9 of them, they are all equally concerned about this. And so specifically at the sheriff's office, what we've done is we've reassigned our patrol staff. And we've done it for 2 different reasons. One is to both protect our patrol deputies so that if we do get an infection within the department, then we can kind of limit that to a certain squad. So that's one of the reasons. But we've also done it so that we can get more deputies out on the streets actively working to prevent crimes from happening. And not only have we reallocated some of our patrol staff, but we've also taken some of our specialty units, our community deputy unit, our special vehicle unit, and we have reallocated them directly to patrol. So on any given day, on any given shift, there are at least 15 deputies that are working the streets, which is almost double what it used to be, about half again as much. And we have at least 2 or 3 sergeants and a lieutenant on duty. So there are a number of additional cops that are out on the street, specifically out there to protect the community. Additionally, we reassigned our air support unit, which is our helicopter unit. It's a specialty assignment, a collateral assignment, so they would only fly at certain times. We have staffed that unit full-time now. So the helicopter is going to be flying around 7 days a week. You will see a lot more of it. Just because you see it, it does not mean that you need to be alarmed. They are doing obviously patrol-related things. They may be on, a hot call or a more critical call, but they're also doing a number of other things. They are flying over our schools, a lot of our closed businesses, specifically to prevent theft, looting, and so on. They're also looking for homeless camps so that we can try to address those moving forward proactively. So you'll see the helicopter a lot more.
Thank you, Sheriff. Terrific to hear about all the enhanced safety measures happening right now. We are going to talk now with Ruben Imperial. Welcome, Ruben. You are the director of our Behavioral Health and Recovery Services Department. Can you tell the community a little bit about what your department does?
Yes, we're the county's behavioral health department. We provide mental health services for adults with severe mental illness and for children with severe emotional disturbances. And we also provide outpatient and residential substance use disorder treatment as well. And we are the county's public guardian.
Thank you, Ruben. So this next question has a lot to do with what Sheriff Dirksey was just talking about, the release of inmates. We know that your department has a lot to do with mental health programs for inmates. Have you tried to make contact or reconnect with some of those inmates? What are you doing in that realm?
Yeah, no, we have great partnerships with the Sheriff's Department, our probation department, all of our law enforcement partners. And what we did is we coordinated with them. We were able to identify the folks that were being released and those that were connected to our treatment services currently or in times past. And we actually were in contact with them as they were releasing them, making sure that for those that were being released, we were able to provide options for them in terms of getting an assessment or back into treatment. Also, those folks that were being discharged with, psychiatric medication or other types of things, we were also coordinating that with them as well. So it was for those, at least with severe mental illness that we had been connected with, we knew who they were, and we were able to coordinate with the Sheriff's Office upon their release. So.
Thank you, Ruben. This next question is for Dr. V, and this is in regards to the numbers. This was a Facebook question that came in over the last week, and the question is, why are there so many negative test results? This person's understanding is that only highly suspected illnesses are tested, and could these be false negatives? And they also want to know, are the recovered numbers reported each day part of the total number of positive tests?
Okay, so I'll try to remember to answer all of those. We don't necessarily know all the people who are testing negative. Providers out in the community can order the tests, and so it's not reported to public health what their symptoms are. So that makes it hard to speak with, are they false negatives or true? That's hard to answer. A lot of the ability to get a positive test depends on how well the sample is taken with that swab we were talking about. So that's a difficult question. But what we do see, I guess, and one other thing I'd like to say about that is there are many reasons to have a fever and a cough and shortness of breath. This COVID-19 isn't the only thing causing disease. Influenza is still around, and so there are other viral respiratory diseases that can be causing this. There's many others that we can talk about at some time. But so just because it's not testing positive for COVID-19, I would say that the actions people should take are still the same. They need to stay home when sick, and not go places and risk transferring the infection to someone else, whether it's COVID-19 or not. Did I hit all those questions?
The second portion of the question, and this is actually a question we received quite a bit. Of the recovered numbers that are reported each day,
yes.
Are they part of the total number for positive tests?
Yes. So those are people that we have reported as positive who have since recovered. So they are included in the total positive tests. So if you take the 177 and we have 77, I believe, if my numbers are remembering correct, so that means 100 people are still not considered recovered at this time.
Thank you for clarifying that, Dr. V. Here's another question that came in from one of our Facebook viewers. Jeanette wants to know, can you tell us what the turnaround time for testing is and how many days we are behind?
Yeah, so in the beginning when the commercial labs came on, or even before that, when we had to ship across the country to CDC, there was a longer turnaround time. Turnaround time is very short now. It's averaging at 1 day. So we are getting test results back quite quickly, which is great. It's very helpful for everyone. I mean, that's the average. So it's shorter, because if you get it in, you can get answers same day, depending on the timing of the sample. And there is longer, so not everybody's going to get it, but our average over all the tests, we just looked at it again today, is 1 day. So that's a great turnaround time right now.
Thank you, Dr. V. This next question is for the sheriff. A viewer wrote on our Facebook page, we're now weeks into the shelter-in-place order. This has hurt many people's ability to go to work. Have you seen evidence of this frustration, and are people more agitated or depressed as a result?
Yeah, as far as the agitated or depressed, that's probably going to be specifically a better topic for Ruben to address. But what I will say is this: we are absolutely seeing an increase in alcohol-related crimes, whether it's drunk driving, public intoxication, any combination thereof, and also potential suicide attempts. There is, I can't give you kind of the statistical update or uptick at the moment, but they are definitely out there right now. And I think what you're seeing specific to the alcohol side of it is people are either a combination of bored, depressed, angry, looking for some sort of escape, and so they're turning to alcohol, and they're getting out there on the streets, they're driving, and they are putting themselves at risk, they're putting the public at risk simply by doing that. And so, it would, like all things, everyone needs to, if you're going to drink, stay at home. You're supposed to be staying at home anyway. So don't get out there in public and do that, because you're causing a problem, obviously, for the public in general. And you're actually increasing calls for service in those particular categories that my team has to deal with, that's preventing us from dealing with other things like theft-related issues.
Thank you, Sheriff. Ruben, this one's for you. So we have seen in the news that alcohol consumption is up, and we just heard the sheriff talk about that. We also know that medical experts have talked about the health impacts of COVID-19 running deep and how this can be a trigger for stress response and depression. What would you tell someone who thinks they're experiencing a mental health crisis?
Well, The first thing I'll say is that this is an unprecedented time, right? And it's unprecedented for many parts of our community, for our system, for our services. And in behavioral health, this is also an unprecedented time for us. I think in addition to the public health crisis related to COVID-19, we're in a crisis in our community, around just social isolation and people lacking connection. And it's important that folks, when it comes to their behavioral health, understand how important it is that we continue in some way to connect with others. And although we're physically distancing ourselves, that it's very important to make very intentional efforts to reach out, to connect, to build support for yourselves. And in the event that is not there for you, and if you are concerned about your mental health, whether it's a mental illness or you're feeling anxiety or depression or a substance use issue you're concerned about, we'd like to let you know to call us and let us help you figure out what level of support you need, what might be able to connect you with your health provider, might be able to connect you with community support, and also treatment at times. So we do have our access line that is available for our community. The number is 558-4600. And we want the community to know that if you are concerned about a mental health, a substance use disorder issue for yourself or a loved one, you don't have to figure out that alone. I know folks have questions about signs and symptoms, and if the first sign is if you have a concern, call us. Let us help you figure out what would be a good next step and help you get to the support you need, or the treatment that you need. And I will say, anxiety or depression right now is given the circumstances are in, is a reasonable thing to feel for all of us. We're all experiencing this event, and we're all experiencing it in different ways. And for some of us, we have really healthy ways of coping and dealing with everyday stress even before COVID-19, and that's carrying on into this crisis. But for some of us as well, the way we've dealt with things before COVID-19 and all the added stress and anxiety and the things we're hearing, maybe it's time for some of us to reach out and call for some extra help or extra support. And that's why we want folks to know they can call us, we can help them figure out those questions, and that number is 558-4600.
Thank you so much, Ruben. This next question is for Dr. V. This comes in right after the Easter weekend and also Passover. This is from Casey Zia. Casey wants to know, will churches not be allowed to gather for up to a year?
That's a hard question. As we look towards the future, this virus we have no indication that this virus is going to go away. Our assumption is that the virus is going to stay with us, and we do not have enough people who have been infected yet to have what we call herd immunity. I'm sure you've heard that. We need 80 to 90% to get good herd immunity. There are many people in churches who are at risk for severe disease, and we want to make sure they are protected. So as we look to the future, one of the things that we're seeing is that we need to find a new normal until we have a vaccine out, or if this virus happens to go away, that's great. But so what will this new normal look like? How can we look to the future at the things we do, whether it's restaurants, whether it's churches, the way that we do our business and our play, and how can we do that in a way that is going to not put people, especially people at risk for severe disease, at risk for infection? And I think it's going to take all of us thinking about how we reimagine this. So how will churches look like over the coming year as we look at how we can open up activities without putting more people at risk? So it's going to take all of us thinking together and coming up with a plan to address this. So I don't yet have an answer to your question, and I think input on this would be great about how this can be done in a manner that doesn't lead to spread of viral respiratory infections.
Thank you, Dr. V. We're going to stay with you for a second because I have a related question here. Many of us watched Governor Newsom's briefing yesterday, and he called this the optimistic phase. He said that we have bent the curve, and we will slowly now soon be transitioning from surge to suppression. He suggested a modified shelter-in-place order may come in the next few weeks. Do you think that timing makes sense for us here in Stanislaus County?
I think that will remain to be seen. So we are, we've been seeing quite a few cases lately, and so we are lagging behind the Bay Area. As you know, they were having a lot of cases when we really didn't have any, and so now we're having a quite large percentage increase each day, and that's not what they're seeing. So we're lagging behind them in a few weeks. So what will it look like in a couple weeks? I'm not sure. So we'll have to wait and see what the timing looks like. I know Governor Newsom said in a couple weeks, maybe we'll start talking about a date, so we will be reassessing, looking at where we stand at that time and seeing how this works for us. So that's the best answer I can give right now.
Dr. V, since you brought up the notion of herd immunity, did you want to explain a little bit about what that is?
Yeah, so herd immunity is it's the level of immunity in a population. It comes from animal science, as you can tell, so I guess we're a herd. So it comes from the level of immunity that's built up to prevent spread of disease, or keep it down to a level, as they say, a simmer, not a boil. So keep it down to a level where healthcare system can keep up, and it's not overwhelming society with absenteeism from work and things like that. So that's really what herd immunity is about, having a level of people around you that are not susceptible to the disease, and that slows spread.
One more for you.
Okay.
This Facebook question came from Melanie. She wants to know, what has public health done in regards to contact tracing of the positive COVID-19 cases, and are families and friends being monitored, or were they tested?
So we get a lot of questions about what contact investigations look like. So when we get a report of a positive case, and by law it is required to be reported to public health, so we should know about all of them. I saw that question come in. We contact that person, and we establish when the symptoms started, and so we establish what we call the infectious period. And then we ask them to, where have they been during that time, have them pull out their calendar, really look at where they've been and who could possibly have been exposed. And then we notify those people about the exposure. The highest risk of exposure is in household contacts, because they spend the most time with the person, and they're in the same environment. They're spending more time face to face. Most people feel more comfortable in their home and, sit on the couch side by side. And so most of what we see is spread in homes. And so that's important to look at who's symptomatic, who could possibly be infected. But that's basically what we do in a contact investigation.
Thank you, Dr. V. This next question is for Sheriff Dirksey. This comes in from Rachel Barfield Wilder off our live Facebook feed. Rachel is asking, will there be any way to reverse the zero bail ruling prior to the end of the state of emergency for California? Or is it set in stone until well after the emergency is lifted?
So the short answer is yes, it could be redone. So kind of the update on that is that the JCC ruling is in effect until the state of emergency is over, plus 90 days. And so it would, if it ended on July 1st, and I'm not saying that it will, so please don't go down that road, but if it ended on July 1st, it would extend for 90 days past that. So with that, it was a court ruling, so the court could issue another ruling changing that. Obviously, that is not something that is within our control, but yes, that could be done.
Follow-up question also from our live Facebook feed. What type of crimes were released inmates committing?
So the number one crime of all of them, so we've released 99 prisoners to date as of 2 hours ago. And so of that, the number one crime that they had committed across the board was grand theft auto. That was the single biggest crime category out there. With that, though, many of the crimes revolved around theft in general, whether grand theft, burglary, petty theft, shoplifting, something in that category. Then the next biggest group would have been drug offenses. And we're not talking about misdemeanor drug offenses, mere possession of drugs or paraphernalia. Many of those that were released were arrested for transportation or sales of drugs. So, typically larger amounts of drugs. We had several that were arrested for, there's a specific charge for a weapon and drugs at the same time. Several of those were on there.